Hello friends. Listening to the constant news about the COVID deaths, one of my friend's son happened to ask him, Papa, is the world going to end now? Another friend's son, out of anxiety, was complaining, Mummy, why are children not being given vaccines? What is our fault? I came to know about a lady. She lives in a village. Her son was working in a town, and she came to know he has got COVID now, and he has been admitted to a hospital. The kind of stuff she had heard about COVID made her start to panic. Okay, most probably he's going to die now, and after a COVID death, I won't be able to even see his body. Thinking about all this, she was so grief-struck that she committed suicide. Listening to such things, I got concerned. Are we passing across the right message? Yes, the situation is serious, but it is not that out of control that we need to panic. When people panic, besides the emotional distress that it creates, it also decreases the ability of people to respond to the challenge in a constructive way. Rather than helping people who have COVID, because of the excessive fear, people start making life more difficult for them. Hence, it is important that all of us take a balanced perspective at this situation and help people around us also do the same. Hence, I wish to keep before you certain facts. 1. Out of all the people who have tested positive for COVID in India, only 1.1% people have died, which means 99% people are able to successfully overcome this infection. Second, as we know, in many people, COVID infection is pretty mild. They hardly get any symptoms. Because of this and many other factors, a lot of people never get themselves tested for COVID. Hence, if we want an accurate estimate of what proportion of infections result in a death, then we need to do the COVID test on everyone in a particular area and then look at how many deaths occurred there. The infection fatality rate of COVID in Mumbai was estimated based on a seroprevalence data to be 0.23%. The author of this paper had kept in mind that a lot of underreporting can also be there, and he had factored this in while he calculated this value. And this value is pretty similar to meta-analysis done across the world. Example, a report published in a World Health Organization bulletin in which data of 51 locations was studied. According to that report also, the average COVID infection fatality rate is 0.23%, which means that if 10,000 people get infected by this virus, around 23 people are likely to die. Now each death is important because it brings a lot of pain to that family, and hence all that can be done to keep the death toll to the minimum should be done. The point is, while we are trying to evaluate how serious has been the impact of this pandemic, then we need to keep the infection fatality rate also in mind. Third, the new variants of the virus, the British variant, the double mutant, they are able to infect more number of people, and hence the second wave is spreading fast. Obviously, people are regarding them to be more dangerous. However, it's important to keep in mind that while these new variants are able to infect more number of people, their ability to cause a serious infection resulting into a death is not higher compared to the previous strains. Their fatality is not more. Fourth, in the second wave, a lot of people are getting infected. A lot of children are also getting infected. And usually children are more vulnerable to infections, and hence people are concerned what will happen to our children. Now, along with all the bad things about COVID, one good thing about COVID is that children are relatively safe. Majority children develop a mild infection and within few days they are out of it. So, children do not need to worry. While the infection fatality rate in the elderly age group is pretty significant, in young people below the age of 50 years, the infection fatality rate is 0.04%. Yes, few deaths are happening in young people and children also. Especially young people with hypertension, diabetes or some other illness, they do have a significant risk. Hence, everyone must follow the precautions. If a person develops symptoms suggestive of COVID, he must get tested and he must take treatment in time. So, the death rate in COVID is low. And now, mankind has come up with effective treatment with which we can save majority of those who get a severe infection also. The reason for current concern is that the second wave has come so fast and the surge in the number of patients is so sudden and so dramatic that the capacity of hospitals to cater to them has been overwhelmed. So yes, we should have been prepared better. Our preparations fell short. However, now governments, corporates, NGOs, hospitals are all aggressively responding to the situation and things are improving. Example, NGO called Doctors for You within a short time set up 4 COVID care centers in Delhi along with the government. The total bed capacity is 2,200 beds. Doctors for You has started 15 COVID care centers across 6 states. Army, corporates are also setting up centers at different places. In Pune, Army has started a setup with 5,000 beds. All state governments are focusing on increasing the number of COVID beds. Regarding oxygen, the supply of oxygen to the industries has been stopped and the entire quota is being diverted to hospitals. However, we should keep in mind that oxygen is an inflammable gas. It's not so easy to transport it from one place to the other. It requires special containers. Now, with the help of trains and aeroplanes, these containers are being transported fast. Tata Group is importing new specialized containers. Many countries are sending in oxygen tankers, oxygen concentrators and other equipment. Scientists at Indian Institute of Petroleum, Dehradun, have designed an on-site oxygen enrichment plant which can be set up in the hospital campus itself within a few days. Many hospitals, private and government, are setting up such oxygen plants within their campuses to improve the supply of oxygen. Because of efforts of all these people, the situation is improving. But till the hospitals are able to manage the number of people who are coming, what do we do? 1. Until extremely necessary, please do not step out of your home till the second wave subsides. And if you have to step out, then please wear the mask on your nose and not on your neck. And keep the physical distance of 2 meters from people around you. And it may bring you some relief to know that in some places like Mumbai and Pune, where the second wave started, it has already begun to subside. Example, in Mumbai, on the 4th of April, the number of new cases was around 11,000 and by 30th of April, it had dropped to around 4,000. Friends, dangerous pandemics like smallpox, plague, Spanish flu have come and gone. Mankind has defeated them. Then what is COVID? What chances does COVID have in front of us? Doctors, nurses, ward boys are working day and night to save people. Many industries are providing oxygen free to hospitals. When someone gets COVID, neighbors are wholeheartedly supporting each other. Scientists are working hard to invent new vaccines and medicines. Example, a new medicine called Molnupiravir is in the last phases of human trials now, and current research says that it is extremely effective in neutralizing this virus. It may take us some time, but this pandemic is also bound to get defeated. So, what am I trying to say? Is there no reason for any concern? No, I'm not saying that. I'm saying there is no reason for panic either. The infection fatality rate is low, and with collective efforts, we will again be in control of the situation soon. What can all of us do so that the second wave subsides faster and a third wave doesn't come? One, we can avoid social and religious gatherings, marriage functions, etc. at least for the next 6 months, till a significant proportion of the population doesn't get vaccinated. Second, don't listen to the fear mongers. Across the world, all experts are unanimous in their view that taking a vaccine decreases the risk of a severe infection and death significantly. Countries wherein significant people have been vaccinated, they've also started their schools. Vaccines are effective and safe. And third, of course, wear the masks properly. When you wear a mask, the risk of you getting infected decreases significantly. And even if you get infected, if the mask is worn, the number of virus particles which enter your body is lesser, and hence your risk of a serious infection is lower. The more precautions we follow, less will be the number of deaths, less will be the need for lockdowns, less will be our worries. And of course, one very good way to decrease anxiety is to start doing something to mitigate the situation that is causing the anxiety. It shifts us from being a part of the problem to being a part of the solution. So you can volunteer or donate to any organization which is trying to respond to this pandemic in any way. One more way you can contribute is, as you know, that because of the lockdown and fear of the pandemic, a lot of people have lost their jobs and a lot of people are facing extreme financial difficulties. Many people are not able to get 2 square meals a day. And when that starts to happen, the body's immunity starts dropping and their capacity to fight back the virus decreases, making them more vulnerable to developing a serious COVID infection. It's the collective responsibility of our society to make sure that everyone gets 2 square meals a day. We can support the organizations which are trying to feed people so that they are able to feed more number of people. All of us are under financial stress. But while doing financial transactions with people who are handling more financial stress than us, if we open up our hearts a bit, then that will make a big difference to them. Friends, if we get united and fight, we'll be able to defeat this pandemic faster. I pray for the health and happiness of your family. Thank you.